I will call him John Doe, not his real name, of course. Dr. Doe was a distinguished graduate of the University of Mississippi Medical Center, and after completing medical school, began a residency in OBGYN at the University of Mississippi. He impressed his faculty, fellow residents, and community physicians. And after completing his residency, he was offered a position in a very well-respected practice in Jackson. Soon after he started in practice, the young new editor of the Jackson Clarion Ledger and his wife came to see Dr. Doe for their first prenatal examination. Several days after this professional consultation, an editorial appeared in the newspaper as follows. The editor said, "We expected to see Dr. Doe, not John. He came dressed more for a golf game than a professional consultation. He wore a golf shirt, casual slacks, casual shoes." And then the editor went on to talk about his perceptions of a physician and what a physician represents. Dr. Doe was devastated. Dr. Doe forgot the meaning of the white coat. Dean Faulkner, Dean Collins, fellow faculty members, entering class of 1918, family, friends, 2018. That's a big one. Actually, Dean Faulkner has just given my address, so I can sit down and say thank you very much. But nevertheless, welcome everyone, and thank you for inviting me to give this lecture. It's a real honor to be asked to do this. The white coat ceremony is a recent addition to the initiation into the medical profession. It first occurred 25 years ago in 1989, at the University of Chicago, and subsequently has become a worldwide event for first-year medical students beginning their professional career. It really inculcates you into the principles of becoming and being a physician. This morning I'll talk about the symbol of the white coat and what it means to physicians and to patients. The three ancient learned professions, theology, law, and medicine, each has its distinctive dress. The clergy wear mitres and religious vestments. Judges wear long black robes, and physicians wear long white coats. Each distinguishes the profession. Nearly 25 years ago, a pediatrics department conducted an experiment where they randomized their resident physicians, and half of the physicians wore a white coat and tie. The other half wore no white coat and an open collared shirt. Parents were asked which of these physicians seemed to be most professional and most knowledgeable in taking care of their children. Well, those wearing the white coat and the tie were perceived to be more knowledgeable and more professional. Then they reversed the roles, and the group wearing the open collar shirts took the role of the white coat and tie, and the results were the same. So there's a perception of you as a physician as how you present yourself. So the question today is, what is the meaning of the white coat? And why are you receiving your white coat today instead of 4 years from now when you receive your degree of Doctor of Medicine? Well, after receiving this invitation several weeks ago, I asked our current third-year medical students rotating through OBGYN what the white coat means to them. And so this is what they told me. First, the white coat is a symbol of responsibility. 2, the white coat is a symbol of commitment to lifelong learning. 3, the white coat is a symbol of integrity. 4, the white coat is a symbol to commitment to holding confidential patient secrets, fears, and intimate thoughts. 5, white coat is a symbol and source of infectious diseases. And 6, the white coat can weigh you down. Now, I could not have produced a better list of reasons for the white coat and the symbol of the white coat, so including infectious diseases and weighing you down. So I will discuss each of these responses. First, responsibility. I don't know what motivated each of you to pursue the goal of becoming a physician, but I do know that the motivating factor was not money. Even though physicians enjoy a typical, comfortable lifestyle and recognition by society, there are many careers that provide greater financial reward than medicine. No profession has more demands than medicine for time and for continuous learning. You've chosen a profession that will become increasingly demanding over time. You will be called doctor. You will be called physician. The word doctor comes from the Latin verb, docere, to teach. The word physician comes from the Greek verb physikos, to heal. You will be called both teacher and physician. With these designations come great responsibilities. There will be times when your responsibility is solely to your patients. These times may be inconvenient for your personal life, but when your primary responsibility is to patients, patients come first. Perry Klass, a professor of pediatrics at Harvard Medical College, wrote a book when she was a pediatrics resident entitled Other Women's Children. In this book, she describes her dilemma when her own child was sick, but her responsibility was to her patients, other women's children. I recommend this book to you as it emphasizes your responsibilities as a physician and provides insights about integrating your professional and personal life. When you become a third-year medical student, you will begin to subordinate your personal life to that of your patients, and you will take on increasing clinical responsibilities. A family physician, a close friend of mine, Dr. Oscar Lovelace of Prosperity, South Carolina, has just been named National Family Physician of the Year by the American Academy of Family Physicians. He will receive that honor in Washington, D.C. in October at the annual AAFP meeting. Oscar called to tell me about this honor, and he also told me about recently having to fire one of his physician associates. He said he had to fire this physician because of failure to communicate with patients about laboratory studies or imaging information, about failing to meet his appointment schedule in a timely manner, and failing to put patients first when he was on call. When I told Oscar that I was delivering this address this morning, he said, quote, "Tell the entering class, there is no room in medicine for mediocrity." Second, commitment to lifelong learning. You proved yourselves when you were admitted to medical school as a superior student who can handle large volumes of complex material. In June, when you began your first year classes, you found that the volume and complexity of your course intensified compared with your undergraduate curriculum. Once you're graduated from medical school, learning does not stop. It is said that 50% of medical knowledge becomes obsolete within 5 years. It's replaced by new knowledge from scientific discovery, pharmacologic innovation, new technologies, and new treatment protocols and methods. Learning never stops. I marvel at the changes in medicine I've witnessed since I graduated from the University of North Carolina in 1965, almost 50 years ago. Many diseases that were fatal then are now chronic diseases that are managed so that patients can live healthy, productive lives. Scientific discovery and innovation will not stop during your professional career, but only increase. The internet enables widespread dissemination of information at light speed around the globe. This spurs implementation of medical discovery and protocol. Often you will find that your patients are as knowledgeable as you about their particular disease. This past Tuesday morning, I saw a woman who had had 3 pregnancy miscarriages. She asked me if I would perform an obscure, almost unknown test, an anti-Mullerian hormone assay, to evaluate her ovarian reserve. She had learned this over the internet, and she knew more than most physicians would know about this particular evaluation. Always ask your patients their understanding of their symptoms and their understanding of their disease, because in getting their understanding will help you better evaluate and treat them and develop a treatment plan. Third, integrity and confidentiality. As a physician, you are held to a higher standard. People expect physicians to hold themselves to the highest personal standards and to be of unquestioned integrity. The admissions committee of Meharry Medical College, in selecting you for this class, made a judgment about your personal standards and integrity. For each of you receiving your white coat this morning, 5 other applicants were not admitted to Meharry Medical College. Many factors went into your selection: academic performance, success on the MCAT examination, your personal statement, the opinions of those who wrote recommendations for you, and the impression that you made on those interviewing you for this position. Many who were not selected had the same qualifications, but you were selected. Your faculty, fellow students, and the staff with whom you work and your patients assume that your integrity cannot be questioned. In working with patients, they will tell you personal stories that reveal their innermost secrets, fears, joys. You will hear confessions of marital infidelity, of a pregnancy termination, of drug abuse, of fears of death, of the joys of the birth of a child. You must hold these stories and confessions in trust. Of the 3 ancient learned professions, theology, law, and medicine, you are a physician. You're not a clergyman. You're not a judge. You have no authority to